are opening up.
Give it just a second. I don't know how long it takes folks to file in from the lobby of a Zoom call. Well, I guess we'll go ahead and get started. My name is Brian Russell. I am the programming co-chair for the Public Relations Society of America St. Louis chapter. And with us today, we have a couple of speakers who are going to tell us all about COVID communications. I'm very excited and grateful to have with us Bob Davidson. He is the System Vice President of Marketing and Communications for SSM Health, and Stephanie Zoller-Miller, who is the Regional Manager of Marketing and Communications for SSM. A little bit of background on both of them. Bob has worked for 27 years in healthcare marketing and communications in St. Louis. Previously, he has led marketing and communications functions at Mercy and at SSM Health Cardinal Glennon Children's Hospital, and has been in communications roles at Shriners Hospital for Children and Fleischman Hillard. Bob has a master's degree in media communications from Webster, where he was also an adjunct professor of communications for 10 years. And Stephanie has worked in healthcare communications for 4 years, currently manager of communications for SSM. She also serves as the public information officer for the St. Louis Metropolitan Pandemic Task Force. So she has a very unique view into COVID and COVID communications that she's going to explain to us here shortly. Previously, Stephanie spent nearly 18 years as a producer at KSDK, the NBC affiliate in St. Louis, where she was nominated for 2 Mid-American Emmy Awards. And she had similar roles in Tallahassee, Florida at Florida's News Channel and WQAD in Moline, Illinois. And Stephanie has an MBA from Webster University and an undergrad degree in journalism and broadcast communications from St. Ambrose University in Davenport. So I'm going to turn it over to Bob and Stephanie in just a moment. Obviously, as they go through the presentation, it will probably spark questions and comments from members. So I would encourage you to open the chat box. And if you have any comments or questions as they're presenting, please put them in the chat box. There is time at the end for questions. And as I was talking to Bob and Stephanie before we started, they're hoping to get a lot of questions. Most of their presentation is fairly short. So hopefully the group of us that we have here, we can come up with some interesting questions for them. So with that, Bob, Stephanie, I will turn it over to you. And again, thank you very much for being here.
All right, thank you, Brian. And thanks to everyone who made time to join the call today. We're really looking forward to hearing from you as we also will share some information with you up front. And you know, when Stephanie and I were pulling together our thoughts around this topic, one of the things that occurred to me was that in many respects, communicating in this COVID environment for us is very similar to the work that all of you are doing in whatever industry you're in, because this COVID communications has been all about trying to find our way in what is a really challenging situation, something the likes of which none of us have ever seen before, and hopefully won't see again anytime soon. And trying to learn from our experience as we go, trying to improve our communications outreach as we go, whether it's internal comms or external. And we're going to talk about a lot of those things today, maybe tell a few stories, and hopefully you'll be able to commiserate with some of the things that we've come up against. One other thing that I would say I never would have really guessed would happen for us is the level of collaboration that we've been able to have with people that you would ordinarily consider competitors. So other health systems in the St. Louis area, for example, who, you know, we know them, we're familiar with them, and we're generally friendly with them. But when it comes to business, you know, we're all trying to make the most of our opportunities. When it comes to COVID, and you're going to hear Stephanie talk a lot about this, it's been very important for us to join hands and to approach our community in a way that will offer accurate, timely information and benefit people who really need to know what to do about COVID and to protect themselves and their families. And then I'd say too, when it comes to internal and external communications, it's been important for us to understand that people are scared. I mean, when we first started seeing the really ravaged areas like Italy in the early going, for example, where they talked about, you know, doctors having to make a decision which patient would live or die. That's a really scary thing, not only as a health system or as health communicators, but just as humans. It's hard for us to picture something like that. So we have concern for our own health, we have concern for our families and our friends, just like you do. And then I think people all across our country have been concerned about their jobs as well, because so much has changed in this environment. So against that backdrop, what we wanted to do was to talk a little bit about what it's like to perform the communications function within a health system and within hospitals during this COVID time. So Steph, if you wouldn't mind advancing us a slide. I'll tell you, this is it's a pretty vivid memory for me, and I know it is for Stephanie as well. Our clinicians were having conversations all the way back in December of 19 about this emerging novel coronavirus and, you know, what it could mean for us and for our country. And credit to those really smart people. They had us well prepared operationally and clinically to do what we needed to do. But I remember in January of 2020, so gosh, over a year ago now, I received a call from a reporter who asked if we knew anything about this COVID-19 thing that was happening, and it's on its way to the United States. And Stephanie and I talked about it. We made an outreach to the gentleman that you see in this photograph, Dr. Alex Garza, and he did his first interview about COVID-19 in January. And I remember I was actually standing probably about 30 feet from where I am sitting right now when I talked to Dr. Garza about it. And frankly, I didn't know anything about COVID and didn't have any idea of what this would become and what it would mean for our country and really for the whole world. But Dr. Garza was very familiar, and he, since that first interview, he's done probably hundreds of interviews. He has done a great number of press briefings that were daily for a while. Now they're weekly, that Stephanie helps to coordinate. And he's done quite a lot of national exposure as well. He is someone who represents the St. Louis area very, very well, and helps us to reassure the public and to share information that people need to protect themselves. I'll say too, as you see on the screen, there are a lot of moving parts to a health system and a lot of things that need to move in coordination in order to make sure that we're doing the things we need to do to provide treatment, to provide protection, to provide vaccination now at this stage. So, so credit to those folks within our health systems, not only at SSM, but all across the area, who have stepped in and have done that just expertly. Okay, Steph, you can advance, please. So controversy is part of all of our lives, and I know that it comes into yours as well, just like it does ours. But we'd like to say, you know, it's not really a pandemic unless there's a little controversy, by which, of course, we mean a whole lot of controversy. And it has moved, like the controversy cloud has moved with time. For a while there, you may remember that there was a lot of talk about personal protective equipment and what is the right type to be used. What is the right type in a medical setting, in a clinical setting for people to use, and how much of it is available? Because for us and for hospitals, again, all across the country, there was a big challenge with not having enough on hand and concerns about possibly running out of the PPE that we needed to protect our caregivers while we were providing treatment to patients. We also wound up for a time suspending elective procedures. So telling people you can't come to the hospital right now to have that elective procedure done is it's a difficult message. And we also at times have found ourselves, like now, for example, encouraging people to come back into the hospital and back into medical offices. And so we know that can be confusing for people at times, but at all times, our plans and the things we've communicated have been about keeping the public and our caregivers as safe as they can possibly be. Same would be true with that next point around hospital visitation. As you can imagine, there's an awful lot of angst when a loved one goes into the hospital and people want to be able to visit. For a while there, we were allowing no visitors, which was really difficult. And I'll tell you, occasionally you'll get reached out to by someone who's pretty influential, someone who wields either political or celebrity power, things like that, and want to be able to come in and visit a loved one. And it's a real test, I think, of your organizational fortitude to be able to say, I'm sorry, but we just can't allow that to happen right now. It's for your protection, for your loved one's protection, and for our caregivers. So that was a tough thing. I can tell you, though, that Stephanie and other members of our communications team were able to do some really special work, things like getting iPads in place so that patients could visit with their loved ones, could see their faces and hear their voices. And that was particularly poignant, and I just think really uplifting work for our team. And then the final point I would share is on vaccine distribution. So we're well into that now. There's a lot of work that's being done to make sure that we distribute the vaccine equitably, and that we work closely with the state of Missouri to make sure that we're putting the vaccine fully to use and to the best use in order to protect our community. More to come on that, but I think right now I'll turn it over to Stephanie. And while she goes to the next slide, I'll tell you, Brian had mentioned that he wanted to hear some stories and things like that. The one story that I'll tell you about PPE is that when that was really raging, and I mean, there were a lot of conversations happening around what's the right thing to do and how do we protect people. And not everybody saw things the same way. In fact, I recall we had one physician who went on Facebook and posted a pretty passionate plea for us to open up the closets and allow them to wear the PPE that she felt was appropriate. And we found ourselves, because we're a family, and that physician is part of our family, and it's important for us to honor people's viewpoints on things. We also had to weigh that against the idea that if we use all of our PPE this week, what do we do next week? And so what we always tried to do was to maintain adherence with CDC guidelines and to make sure that we were fully protecting people that way. The really good news is that PPE supply is fully stocked now. We have everything we need. That's no longer an issue, which is, it's nice to be able to cross that one off the list. Stephanie?
Thank you. So Dr. Garza, or Bob touched on this. I'm looking at a picture of Dr. Garza. Bob touched on this, that early on, we felt the need that we really felt like we were going to be stronger together, we being the health systems. So early on, back in March, Dr. Garza and leaders from our other health systems at Mercy, BJC, and St. Luke's came together to talk about the pandemic and what we were going to be facing, the challenges that we knew were ahead, the challenges that we maybe were not anticipating that were coming. And we very quickly, the leaders in that room, gravitated to Dr. Garza because of his background in the military, his background in leadership with the United States government and the Obama administration. And he very quickly became kind of the center point for that group, and was chosen as the leader and to represent the organizations as a whole. And in that room on that day, the St. Louis Metropolitan Pandemic Task Force was formed. the reason behind it really was, obviously we're stronger together, as we're all facing this, and we're all facing the same challenges. So as we could communicate to the public and communicate to our staffs and stay aligned, we realized that this was really going to help us approach this pandemic in a unique way. Really with communications at the forefront of this, and how we were going to manage the communication from the task force, from our health systems, and from our hospitals. I think back to the first day, as Bob mentioned, we know these communications professionals at all the health systems, we know each other. I've worked with many of them for years, so we're friendly outside of work, but we are competitors, and you would compete to get media stories on the air against each other. But I remember vividly that day, that the first day that I received an email from our friends at BJC, and they said, we got this media question, and it feels like, we're all kind of facing this together. What would you think about a joint statement? And I remember thinking, well, this is gonna kind of rattle some people at the local news stations, like a joint statement from all of the health systems. What would they think? And that was really the first time that we kind of stepped forward as a group of communicators with a message to the media to say, we're in this together. We're here to communicate, and here we are as a group. So we started that very early on in March. In April 9th, April 5th to be exact, we held our first Metropolitan Pandemic Task Force briefing. It was at St. Louis University High School on a Saturday. We had leaders, government leaders from across the region. We had healthcare leaders from across the region. And we all stood together and talked about the pandemic and what we were facing, and to really come forward to tell the public what was going to be happening. We wanted to be a voice of reason. We wanted to be a voice of transparency. We wanted to make sure that everybody knew what we were facing, and what they needed to do to protect themselves, the community, their neighbors, their loved ones. And that was really the whole goal behind the task force. So that was an amazing day. I look back to that Saturday, not ever thinking that I would be personally playing the role that I did moving forward. So when the task force was formed, I was not leading the communication side of the task force. There was a group of others that were doing that for the first couple of months. I joined the task force in June. At that point, Bob very nicely came to me and said, "Hey, I've got this thing I need you to help us with." Thanks, Bob. So I was like, "Oh, sure, I'll help you whatever you need." And Dr. Garza and I had known each other for a really long time. We had worked together from an SSM standpoint. And so I was excited to get to work with him. I knew how amazing he was to work with. So I joke, and for those of us who are in the communication field and you look for people to do interviews, I joke with him and I call him my shiny unicorn because he's just so amazing at media. So I jumped at the opportunity to work with him again. And in June, I stepped forward to help from a communication standpoint and from the messaging. And early on, the thought behind the task force, our approach to communications has always been to be transparent, to be a voice of reason in the community, to be a voice of science, facts, backing all communications, all of our efforts, and to be open and honest with the media, and to be available to the media to answer their questions. And so that was really a very intentional action that we took very early on to say this was the approach we were going to take. And I think that approach, taking it early on, has shaped our communication efforts for the past year. And it's been and not always something that people do with the media, is to be so open and honest and so inviting. And I really think it's helped form a partnership, and that almost the media has become an honorary member of the Pandemic Task Force as our voice into the community. And it's been an exciting kind of adventure to be on. So while it hasn't always been fun, Bob, it's been a great experience. I'm glad you tagged me in when you did. So one thing I've talked a lot about the media here from an SSM standpoint, handling the media and the interest and the access to media has changed, right? Our world has changed, and we've all kind of been there and experienced this change that we've felt. So of course, COVID has been the lead story, or at least in almost every single newscast or in every single publication for the past year or more. It's really, and I joke that I receive probably between 10 and 15 on an easy day media requests for story ideas, stories that people are working on, quotes, fact checks, things like that for reporters. And so it's intense. It's more than I've ever dealt with from a public relations side of things. So kind of answering those questions and being there. But how we approach media has changed so significantly. As Bob said, we weren't allowing visitors into our hospitals. That includes the media. Some media in town were not allowed to come indoors and to do interviews. So how do we approach that from a storytelling standpoint? So we all had to very quickly get acclimated to Zoom that we're on today, to other virtual platforms for interviews, and how do we set our physicians up to be those experts to help educate the public, and not just Dr. Garza, but other physicians across the region, to be that source, that resource for the community, so that they knew what was happening and they knew how to protect themselves and their family and their loved ones at all costs. We, already talked about, we're reactive media, the media calling us for those stories. We're stronger together when there were those kind of gotcha stories or things that, we thought were maybe going to be those hard questions. We band together as a task force of hospitals and can come forward with a unified statement with how we're going to message this, how we're going to react to these stories. And it's not just one of us out there answering these questions and hanging, out there alone. We're all together, we're stronger together. And so that was really important. And then, of course, always keeping that in the back of our head, that we're here to educate, to inform, and to use science as a background.
One thing I would add to that is that we, especially early on in the pandemic, when not as much was known about COVID and the impact it would have on our community, there was a lot of experience with reporters asking questions that were very provocative and developing stories that were poorly aimed, poorly developed, and would lead to miscommunication. And so we really had to do a lot of sort of negotiation in those relationships to have the reporters understand that we wanted to share appropriate information with them. There's some things we can't share with them, and there are things we could do to help them ensure that they're not developing a story that would work against their purpose of informing the community. So that was a real challenge, especially early on. And then Stephanie, because of just her outstanding relationship building with local media, has been able to get to a point where I feel like we get the benefit of the doubt. Like, if we do the wrong thing, we should be held accountable for it. But if we're doing the right thing, or if we need them to trust us on something, I feel like that trust is there at this point.
Well, and reacting to that, Bob, so often the relationship with the media, they're calling to ask you questions about what's happening, what's going on, and things like that. We've gotten to a point with earning the trust of the media and them understanding that we're in this together, right? We're all in this together. We hear that so often and we feel like it's kind of been overused, but I now have gotten to the point where I'm getting phone calls from these assignment managers, and they're saying, how can I help you today? What can we do from a newsroom perspective? What can my reporters do to help you get the message out that you want to get out? That's a unique thing that the first time it happened, I was like, what do you mean you want to help me? And but it's amazing to be able to call these newsrooms, these assignment managers, and say, look, this is what we're facing. This is a challenge we're facing, and working through that story with them. How can I help you tell that story in a unique way, in a different way? And how can but I need them to tell that story to help get the message out there, to help the community survive this. So it's really become this give and take relationship built on trust, built on relationship building, that has been such an incredible asset throughout this whole thing. I don't know what I would have done without those relationships and without that kind of go-to in my back pocket to be able to say, I need your help. And then they know, yes, we're going to be here to help you, because they trust that I'm there to help them when they need it as well. So that's been great. One other thing, just based on media, you know, we talked about how we weren't letting media into the hospitals and how that was very, a very intentional thing based on our visitation policies. In November, when things got really bad and our hospitals were overwhelmed with patients and with sick individuals, we made a very intentional decision that it was time to open our doors to the media and to let them inside to see what was happening, to tell the stories of our healthcare workers. So we started with bringing together, we hadn't done a live press briefing from the task force standpoint in many, many months. And I went to Dr. Garza and said, you know, we have to do something different. We have to change the narrative. We have to get the stories out there that we're not able to get out there. And we intentionally, from across the health systems, went into our hospitals and found those stories with the nurses and got them to our press conference and had them tell their stories. That was a turning point for us with the media when we gave them that access to those people and said, you know, these are the stories that people need to hear. This is what our nurses are going through. This is what our staff is going through. And they told those stories in an emotional way. That was, you know, such an important moment. And then when we opened the doors and let them come in and get video of our ICUs and of our patients and be on the floors to see just how bad it was in our hospitals, was a turning point from a communication standpoint. So the lesson it taught me was, you know, we always have to be nimble. We have to be ready to change our communications at a moment's notice when the message needs to change. And we can't just stay and say, this is safe. This is where we need to be. This is the line we need to, you know, this is the lane we need to stay in. You have to push the limits when it's the community's life is at risk. And this was the message that we felt like this was the only way we were going to be able to tell that. We had tried so many other things. And that was a real turning point for us with the media. And I think it was an important message to get out there. And I'm really glad that people had the courage to step forward with us and do that. So that was important.
And, you know, on this same topic, another thing I would share that could be a learning that could be applied no matter what your industry is that you may, I hope for your sake, that you never have anything quite like this and the way it's impacted healthcare and our need to communicate. But even in normal times, whatever that is, you can build relationships with media representatives and you can help them do their jobs, and that helps to build that relationship. So by providing access, by providing information, by being timely and being accurate with the things you share with them, you can help them understand that you are a partner in them doing their jobs. And then you can build that relationship and make it stronger. And then the situation that Stephanie talked about where now reporters will call her and say, how can we help you communicate? That can happen even outside of COVID circumstances when you build that relationship of trust and of them knowing that you want to help them get done what they need to get done. Okay, so moving on, the internet's a scary place sometimes, and I will tell you, as a native Texan and a fan of a certain baseball team that got caught cheating a few years ago, I know that it can be a nasty, nasty place as well. And we've experienced some of that with COVID and with healthcare, with allegations of PPE misuse, allegations of us intentionally keeping people away from their families who were hospitalized, allegations of just all sorts of impropriety. And the tough thing with, say, Twitter or Facebook is everybody's an expert. everybody can push things out there, and there's not really that burden of fact that exists with the news media. And so things can catch fire pretty quickly, and it's important to be on top of what's out there. If there's misinformation, try to correct it. And also, I think it's probably important to understand when to just ignore it, just let it go, because you know, occasionally there is a voice out there shouting in the forest by itself. Nobody's listening to it, and there's really no point in engaging with that person. Other times, however, if there's somebody with a platform, it really is important to reach out to them and to, as need be, maybe engage right there on that platform. Although you want to be careful with that, because it can turn into kind of a firefight sometimes. Steph, anything you want to share from this? Or I will say, taking the high road has become something of a second nature for Steph and me, if it wasn't already. We've learned that you can't, as they say, if you roll around in the mud with pigs, then all you get is muddy, and the pig likes it. So we don't.
Yeah, I think just remembering, just always going back to your home-based message of, you know, what we're here for, and communicating that, you know, we're here to educate the community. We're here to share science-based information. Always remembering that, even when it's tough and people are coming after you on these social media accounts, that it's just kind of always going back to that has been kind of where I've always found myself to find, you know, to be comfortable and to know that we're doing the right thing. So, yep. Okay, so from an internal communications, that's the whole other side of this, right? That's the difficult, from an internal standpoint, what are you saying to your employees? How are you keeping them informed? You know, how are we recognizing the incredible sacrifices that they're making, and how that evolves throughout the pandemic? So obviously there were, you know, lots of, at the very beginning, it was tons of food coming into the hospitals, and the community was really recognizing our healthcare heroes and what they were doing. We did some signage outside our hospitals. I have an incredibly talented and creative member of my team who came up with this concept, and really that kind of spread throughout the region, which was so fun to watch. And then how do we communicate the challenges that we're facing, and making sure that our teams know where we are? And again, it goes back to being honest. It goes back to being upfront with them. It goes back to making sure that we're almost over communicating this information, so they feel like they're supported, and they feel like we are here for them. We hear them. We hear the challenges that they're having. The one thing that I think I learned from an internal standpoint, I think we all learned, was it made us look at how we communicate and cascade information internally, and how we needed to fix that. So we very quickly had to adjust a lot of things. You know, we realized that we have a unique workforce that all receive information in different ways. Our nurses are not sitting in front of computers reading their email. An email is not going to work for them. But, you know, some of our office staff does do that. So we need to communicate in several different ways, and making sure that we're always doing that, and making sure we're always thinking about how people receive information. So we worked a lot on cascading information both up to the channels where people could make those decisions, and then cascading the information down once the decisions were made, and how we were going to approach different things. And we came up with this tiered system of huddles, so that we could continue to communicate this information, and what needed to be escalated up and what needed to come down. I think, you know, obviously there's always work to do, and there's always ways to change and improve, but I think, you know, this almost forced us into fixing some of those broken channels, and finding new and unique ways to address these challenges that we were facing in our hospitals. Anything to add, Bob?
No, it's just
okay.
Many faceted, as you indicated. There's so many ways to communicate, and it's important to never stop looking for new ways to reach people.
So what have we learned? Oh my goodness, what have we learned? So many things. I've talked a little bit about that as we've been going through this. So a global pandemic lasts a long time. So I go back to this task force request from Bob when he came to me and said, it's fine, the numbers are low, it's not going to last that much longer, maybe a couple more weeks. Sure. Here we are in March, we're still going. So just thinking through, just when you think it's over, it's not over. So just that longevity and just having the energy to continue. I tell my team all the time to remember to take care of themselves, to step away, to take a break, a mental break from all this. It's really hard. And everybody has hit a breaking point at a different point. You know, and we've all can take on different levels of work and different levels of stress. And so it has been a really long year, but learning that you do have to step away and take a brain break before you kind of hit your breaking point. So that's something I think is really important that we've learned. I've talked about transparency is key, to be always talking about accurate information, giving accurate information, making sure you're checking your facts and being transparent with the media and transparent with the community, be that voice of reason, and make sure you're always telling that story, telling the true story. And people will see right through it if it's not the truth. And then do the right thing. As Bob said, take the high road. We've had a lot of crazy things, which I know you all know have been in the media, but to always take the high road and know that, you know, believe in yourself and know that you've done the right thing, even when there's a lot of negativity being thrown at you, that you can hold your head up high if you continue to take the high road. There's no reason to go low. So those are those important lessons that I believe we've learned. Bob, is there anything else that you feel like you want to add there?
No, I do think on that do the right thing topic, it's so much easier if your organization does the right things and then you're communicating about it. If you ever find yourself in an organization that's doing the wrong things and knows that it's doing the wrong things, frankly, I would say it's a really good time to start looking for a job, because you want to be part of an organization that's doing the right things, at least what it thinks is the right thing at a given time. And then you can help them to spread the word about that. And then as communicators, we have to figure out, you know, what is the right thing for us to do in terms of, should we share this information? Should we try to move public sentiment in this direction or that? Those are important considerations, but as long as your compass needle is always pointed the right direction, then you can at least have the peace of knowing that you're conscientiously trying to follow the right road.
Okay, so then we kind of put some of these questions down that we thought maybe you would be asking. We hope that we could answer them, and obviously we've got some time for questions here at the end. But these are the questions that we thought, you know, were going to be pretty popular. So when can I get the vaccine? I'll tell you that right now, from a healthcare, what they're calling those high throughput healthcare systems, we're vaccinating those who are 70 and older. Those we feel are the most vulnerable in our community, and we're continue to focus on those who are 70 and older. Next week, we believe we'll be moving down to the 65 and older age range. And then after that, we'll be able to move down even further into that tier 2, 1B population. We're going to continue focusing on that population. We do know this week that the governor the state of Missouri opened up the next tier, making another large group of people eligible for vaccines. So our health department, our public health department partners are going to be focusing on those groups and making sure that people like teachers and those other individuals are receiving vaccine and some of these big mass events that are being planned across the region. We did hear some really good news yesterday from the Department of Health and Senior Services that kind of handles the rollout of vaccine, that by the first week of April, we believe we'll have, if not double, maybe triple the amount of vaccine in Region C that we have been receiving over the past several weeks. So that's really, really good news that we're going to be receiving that much vaccine. And really that means that ultimately here later this spring, anyone who wants a vaccine is going to be able to get one. So that's a really, really good news and brings us closer to reaching herd immunity, which is on this slide. When will we reach herd immunity? Our data teams have been working with the task force on kind of compiling some of that data. We do believe that if everything stays exactly as it is right now, which we know we are anticipating that increased level of vaccine into the region, somewhere around the middle of July, we'll reach herd immunity. That is going to always hopefully get better as we get more vaccine into the region. The one thing we do need to be careful about is those variants that we know are circulating in the community, and we have increased shed in our waste systems. We know they're here, that UK variant in particular, which is so highly contagious. So we do need to make sure we're mitigating the spread of that virus, that variant in the community, and that would put us back. So specifically for those who have not been vaccinated. So we do need to continue to do those things like wear a mask and socially distance ourselves and avoid large crowds. But hopefully as we get more vaccine to the region, then we'll see more of that herd immunity kind of reach an earlier date. So hopefully early this summer, we'll see that in the region. And when can I stop wearing a mask? Hopefully this summer when we reach that herd immunity, we'll be able to kind of lessen some of that mask wearing. But for now, we really need people to continue to do that. And then a really important question that I think we need to address is how are we reaching the most vulnerable in our community? How are we making vaccine distribution equitable? We know that many of our communities, those who are at risk are those are Black communities, our communities of color, are really at risk for increased sickness from COVID-19. And really, especially early on, we saw that. So how are we making sure that they're getting the vaccine that they need and making sure that it's an equitable distribution? So SSM Health, I can speak on behalf of SSM Health. We're partnering with Affinia and Home State Health to run some vaccine clinics, mass vaccine events starting the weekend of March 26th and 27th. And we're focused on specific zip codes in the St. Louis region. So I believe it's 8 or 9 zip codes that we'll be focusing on, really making sure we get into those communities to vaccinate those who live there. And we're doing some outreach. And we know that obviously access to the internet and things like that are hard, so they can't pre-register. We're getting teams into those communities to be able to get that vaccine and those appointments made. So I think it's important for us to keep that in mind, that we do need to make sure we're distributing this to those communities who really desperately need it and who are at a higher risk of illness. So there's a lot of work going on around that in the community as well, not just from SSM Health, but everybody.
Yeah, that's really beautifully said. And, to the extent that we protect the most vulnerable in our communities, I think that's really how we can judge ourselves as a society. And so it's important. And as a Catholic health system, we feel it's a sacred responsibility that we have to provide care for the most vulnerable and for those who have the least access to care. So that is a big focal point for us. Thanks for pointing that out, Stephanie. Mm-hmm. So Brian, I think we're ready to take all the challenging questions that you've.
Sure. Yes. Thank you, Bob and Stephanie, for this excellent presentation. This is really interesting and insightful. I also want to mention we've been live streaming this on the PRSA St. Louis Facebook page. And so for anybody who's watching us via Facebook, if you have any questions, obviously you can't ask through Zoom, please post them as a comment beneath the live stream and we will get to those. But for Bob and Stephanie, just some questions kind of to get us started. Obviously, the virus itself and the vaccine and distribution has been politically fraught. How do you kind of thread the needle between getting information out, but avoiding getting dragged into the mud of political mudslinging when it comes to the virus, how dangerous it is, how vaccines are coming, and just all the different aspects of it?
So I'll say and I'm really interested to hear what Stephanie has to say about that too, but I'll say that the challenging thing with threading that needle is that the needle moves. Each day, the factors that you have to consider can vary and they can move about some. And so really, rather than trying to continually thread that needle, I think you're far better off hearkening back to that idea of doing the right thing. So we as an organization and the Pandemic Task Force as a group of health systems and other providers is really trying to do everything in our power to protect the community, to provide treatment as it's needed, to make sure that, you know, we can all get through this together. In terms of the political things that you talked about, certainly we know just what you're talking about, but I feel like there's so much more that can be gained from taking the road of only offering respect and trying to communicate in a way that doesn't engage in sort of the friction that that people so thrive on seeing. It's a lot less exciting, but there's also a lot less that you have to backtrack on later if you start getting out there and you know, fists a flying. Steph, you have anything to add to that?
No, I think you touched on that perfectly. We've always come back and said when these things happen that we're going to rely on the science and we're going to rely on the facts. And we're going to rely on that data and that information to tell our story. We're not going to get drug into the mud. We're not going to continue to point fingers or say anything like that. But we're going to stand up to do the right thing. But we're not going to point fingers, and we're not going to say, well, just, you know, these are the facts and they may have it wrong. We're never going to say they have it wrong. We're going to say, this is the facts. These are our facts. These are the facts. You've trusted us for a year. Just understand that our motive has never changed. Our motive has always been to protect the community and to do the right thing and to help this community survive this. And if we stand by that and continue to do that kind of messaging, we feel like we can hold our heads high and avoid kind of that dirty kind of stuff that we don't really want to get involved with. It's just been kind of the way we've always looked at it. Even before it got, it ebbs and flows, right? But even before the last kind of crazy stuff we went through, we always have kind of addressed it like that. We didn't want to become political. So we've just stayed out of it.
Very good. Kind of a follow-up question a little bit to that. Is there anything that you would do differently if you could go back? Meaning, for example, a lot of the communications that I have seen in relation to the virus talk about how great the vaccine is, how effective it is, but then they follow with a string of caveats about how the vaccine is highly effective, but some people, you may get it and still get COVID, or you may have the virus on you and be able to pass it on even if you don't get sick. And I've heard that some of those caveats have gotten to the point now that people think that the vaccine, is not effective. And so they're not going to get the vaccine. And that clearly is a communications issue. So just using that as a jumping off point, are there any things that you would do differently if you could go back to the start of all this?
You know, I think it's an interesting point you make, Brian, about that vaccine communication, because the flip side of that is if you don't provide those caveats as you described it, then people think, great, I've got my vaccine, don't need to wear a mask, I'm going to run out there and lick every doorknob in town. But you have to be really careful still. I mean, for example, getting flu vaccine doesn't mean you can't get the flu, but it means you're less likely to get the flu. And if you get it, it's going to be less severe. That's the same with COVID vaccine. So it's not a guarantee you can't get infected with COVID. But if you did happen to get infected, you are likely to be less sick. You probably wouldn't have to be hospitalized or have your life threatened. I think that that walking that balance is where I think we're going to have a really good opportunity as we move into if we ever move out of crisis mode with this. We're going to have a really great opportunity to sit down and think about, okay, beyond the sort of surface things that we can say that we learned, are there deep learnings for us about the ways that we communicate? And I would say, I don't know if I would say this is something I would do differently, because I think we've generally done a pretty good job of it, is providing reassurance to people, that it's going to be okay. And we're going to get through this all together. I think sometimes we find ourselves in the mode of sharing fact, science, that it can be a little overwhelming for people and it can be scary. So how do you walk the line of providing science and providing reassurance, but not providing the level of reassurance that people will feel like, oh, it's not that bad, because it really is that bad? Stephanie, anything you would add?
No, I mean, I think we run into this has become, we almost overshare because we don't know what we don't know. And there's so much that we don't know about this virus and honestly about vaccine, right? We think we know stuff, but it hasn't been around long enough for us to really know. So I think a challenge that we run into is that we almost overshare information because we don't have all the answers. So we want to share all the answers we do have. And then so then you do run into this, people picking up those negative things to share instead of sharing the whole story, because there is so much there, specifically with vaccine. So they're just picking up the negatives and sharing the negatives about vaccine. So I do think, we need to be mindful about continuing to share all those positives instead of always going back and focusing on the negatives that maybe you're being pulled out of that information. If I could change it, I'd go back I could go back in time and tell myself a year ago all the stuff that we've learned about COVID. Wouldn't that be great to have a time machine? But
yeah,
I think we've done the best with the information that we've had at the time. And then you can go back and say, oh, well, if we would have known this, then we would have said this instead. So I think we've learned a lot we've learned a lot for the next pandemic.
I'm afraid if you had that time machine, you wouldn't be here now. You would have left a year ago. Some stuck around. Unlike some people, Jason Merrill.
So next question. There's obviously a lot of communications related to the virus and the vaccine. What element has patient privacy played in what you've communicated and how? Because obviously there are HIPAA rules, there are rules regarding taking and sharing people's pictures as they are having medical procedures done, even to the point of just getting stuck in the arm for a vaccine. So talk to us a little bit about how you've had to manage the patient privacy element of COVID communications.
I don't know that it's that much different than what we've done in the past, because it's always been such a focus for us, the privacy of our patients and what information we share. It's always at the forefront of everything we do prior to COVID and then after COVID, it will be. So we've just always continued to be mindful about what we're sharing, when we're sharing it, and making sure that we have the appropriate approval to do that. I think it does make a challenge. The challenge has been for us when we did, specifically in November, when we had those crews in our hospitals and in our ICUs, we don't have the loved ones and the family members there to speak on behalf of those patients who in many cases are vented and are unable to speak for themselves. So you can't get that approval from those loved ones in order to share those stories. So we did run into a little bit of that challenge when we wanted to tell the stories of what was happening in the hospitals in November, particularly because we didn't have the people to ask permission, but you had to get creative. And that's where those iPads really came into use, the relationships that the nurses had built with those families, because they really had become the families of those patients, really helped us be able to connect with those families, to be able to get permission to tell those stories. So while I don't think it's changed how we approach it, we've had to be creative in how we do get permission in some cases, just because of the situation that we find these patients in.
Okay. Next question is, in a lot of organizations and ones that I've worked with, big and small, sometimes it's difficult for communications to kind of get a seat at the table when high-level major decisions and discussions are being made and had. Tell us a little bit about how you were able to get close to the decision makers and be at the table and chip in for communications when it comes to COVID-related decisions and discussions.
That's such a good question, and I really appreciate having it asked, because that's an important thing for all of us who are in communications, to have that voice and to have that opportunity to help even steer organizational decision-making toward what's right. It makes it a lot easier for us to communicate later if we're communicating about things that were done well and with all things considered. We're very fortunate at this organization that within SSM Health, our Chief Marketing Officer, Chief Marketing and Communications Officer, sits on what we call the senior leadership team, which is that core handful of leaders at the very top of our organization. So we are represented at that table. And then within our structure, at the system level and at the regional levels where Stephanie is, communications is very much a part of those conversations. We're pulled in early. Sometimes we're right there at the origin of those conversations about how we're going to approach something operationally and organizationally. And we have that opportunity to weigh in. If you don't have that within your organization now, I think what you can do is start trying to move toward it by building on your credibility, building the trust that your organization has in you. And like a lot of other things in our business, largely it's about relationships and building trust.
And I would add to that, I intentionally actually, and in knowing that SSM does put communications, it's such a focus here. But I did specifically about vaccine rollout when this all started and the conversations happened months ago, back in October. I went to our chief operating officer in the St. Louis region and specifically said, Mike, please include me in every vaccine meeting. And I knew some of those meetings were going to be nothing to me, but I went and said, I want to be part of it. And I just want to make sure that everybody, like, don't be afraid to ask, be part of the conversation. I would have been part of most of those conversations anyway, but I wanted to make sure they understood how important I thought this was from a communication standpoint. So I just want to encourage anybody out there. Now I feel like I can have those conversations with him. I have that kind of relationship. Build those relationships so you can have a conversation like that, and don't be afraid to ask. I want a seat at the table. This is important, and to advocate for it, because it is so important to have that seat is important from the beginning, so you're not playing catch up.
Very good feedback. Thank you. We've got 3 minutes left. One more question, I think, and then we'll wrap up. Is there a myth about the vaccine that you would dispel for anybody who is concerned about getting it? What myths have you heard, and can you dispel those for us?
I've got one.
Go ahead.
Okay, so one myth, and it was perpetuated a little bit by the mayor of Detroit, who said the vaccine coming from Johnson & Johnson was not as effective, and therefore he was not going to allow it to be used in his area because Detroiters deserve the best and all that. In truth, the Johnson & Johnson vaccine is highly effective. It's a 1-dose shot, which is good. What we've been telling people about vaccine is all of the vaccines are very effective. And we would encourage anyone who has an opportunity to get vaccine to get the vaccine, whatever the manufacturer of it is. That's the one that I've heard kicked around a lot, is this vaccine or that vaccine is not as good as the others, and I'm going to hold out for what I want.
And also that the one that you need to make, people need to understand that not everybody's going to get sick from that second dose of the Moderna and Pfizer vaccine. It's only like 15% of people actually get sick and have side effects from that second dose. We are seeing people not come back for the second dose because they're afraid of how sick they're going to get. And they don't want to miss work, and they don't want to miss out on things because they're going to be sick. And if you do have side effects, they typically last less than 24 hours. I can tell you, I know a lot of people who have gotten vaccinated, and I can name on one hand how many people have had a side effect. So it's important for people to know that it's important to get the second vaccine. If you are getting Pfizer or Moderna, it's important to get that second shot. And even if you do get sick, it's very short-lived.
Great. Well, thank you again, Bob and Stephanie, for your time and your expertise in this excellent presentation. I think there's a lot of takeaways for those of us who are in communications outside of the healthcare industry and outside of pandemics. So I really thank you for your time. And a note for everybody watching or anybody who maybe had to miss, this has been recorded. We will share the recording. It's also available on the PRSA St. Louis Facebook page. So again, thank you very much, Bob and Stephanie. This was phenomenal and exceeded even my expectations. I really appreciate your time.
Thank you for having us.
Thanks for having us.
Thanks. Thanks, everybody. See you later.